So,
right.
what next, Chief?
We have another caller, and this one actually is a great one, I think, for both of us. This is Atheist Lisa, she, her, from Canada, wants to talk about what atheists / the scientific community can do about religious beliefs interfering with medical care. Lisa, you are live on Talk Heathen. What is your discussion topic today?
Hi. Sorry, I'm a little nervous.
No problem.
So can I just give like an example of what I mean by that?
Mm-hmm.
Yeah, absolutely.
Okay. I volunteer with a mental health organization in my city. And we deal with people, from all different kinds of mental health disorders. And what I mean is, how do we stop religion from interfering with people getting proper health care? There was someone who we were trying to help in the past, and they were living in a group home. They needed some help taking care of themselves. They had schizophrenia, and all was going well until the people who are running that facility thought that they should do an exorcism on him. And, things like that, not only are they bullshit, but it causes, I think, a lot of emotional damage to people. Some people won't take their kids to the doctor, thoughts and prayers kind of thing, or maybe we're just being tested and our faith needs to get better and they'll get better. But I think sometimes that religion interferes in more areas than we think it does. And it's the religious people who suffer as a result of that. I'm not saying that all religious people, I'm not saying that all religious people have medical neglect. Obviously, that's not true. But I do think that religion can interfere with our physical and mental wellness. And how do we, as atheists, try to put a stop to that from interfering into someone getting medical services?
It is a conundrum. And I don't just take it from an atheist standpoint. It can become a broader topic of people who do not properly engage with medical services due to misinformation. Of course, religion and religious doctrine is very powerful, but you've also got things like the anti-vax movement and stuff like that. And there's two things. One, if it's the caretakers of people who are not engaging with the medical field on behalf of the person they're caring for, especially parents, we do have laws and things around that. But one of the most sacrosanct things, in my opinion, is bodily autonomy. And as unfortunate as it is, we cannot force someone to undertake a medical or mental health intervention without their permission, unless we can declare them unable to make those decisions themselves. And that's very important to me, that patient autonomy and dignity is preserved. And yet we have religious denominations that in their very doctrine prohibit things like blood transfusions for Jehovah's Witnesses, that kind of thing. And there isn't really a very easy way to do it on a broad scale. We can't ban these religions. I wouldn't want to ban them. I wouldn't want to make it illegal to refuse doctors' orders or to have people compelled to undertake a medical procedure that they don't want to do for whatever reason. Now, I am only second-hand in this. I work parallel to the healthcare system in my role in a cancer charity, but these issues pop up. Now, I've also seen the flip side where people are emboldened to keep going and to engage with the medical things, especially when things like really horrific side effects keep people feeling sick. And chemotherapy is real tough on some people, but their faith is one of the things that keeps them strong enough to keep going. So I'm not saying that religion as a whole is entirely detrimental to people's ability to seek the best medical outcomes. But I haven't done a medical ethics class. I think you, Dr. Ben, might have a bit more insight on that.
Yeah, I suppose more, like I said, maybe I was referring more to like ethic, stopping kind of these, I'm trying to figure out how to say it without stopping kind of like religious, like if someone's a caretaker, like you said, and they're religious, like there has to be, I just think that, like,
May I ask a quick question? For the example you gave about the exorcism, was that a group home that was explicitly like labeled as a religious institution, or was this like a group home that services the public and serves as, like a not a specifically religious entity?
I'm not sure if it was religion-based. I don't think it was.
Because if it wasn't a religious institution, like if the patient wasn't consenting to be placed in a religious group home, that's a big legal problem. Because even if you're a minor, or if you're an adult, or if you have whatever condition, it doesn't matter. Like, you should have the ability to consent to what religious procedures are done for you in the same way as medical procedures. Like, if this is a group home meant to help take care of you and keep you safe, make sure you're getting your medical treatments, etc., and you are not explicitly, it's not transparently a religious place, they should not be forcing an exorcism on anybody. They should not be doing that at a public institution. So that's one facet of this.
I just think that, personally, just my opinion, I don't think that religious organizations should have like their own hospitals and be selective based on that religion's morality.
Yeah, I agree.
Or
I don't think so either.
To disclude certain, right? Like, there was a case in my province, a few hours north of here, and there was this, they had one of the things that we're kind of struggling with in the West in Canada is they're creating more, hospitals that are kind of like run by religious groups. And, and I don't care what anyone's opinion is on abortion. My opinion is that it's part of healthcare. I don't know the reason. It's none of my business. But, to not offer, I live in a province that there's only 2 cities. Everywhere else is a rural place. So there aren't a lot of options. But to deny someone, that could possibly be a life-saving procedure. But, if say like they're miscarrying or something, but the nearest hospital is Catholic run and they refuse to do that procedure, right? I just don't think that medical groups should really be involved in medical care. I think it's wrong. And I also think that, and this is just my opinion, right? When people are suffering, when people are desperate, sometimes they do turn to religion. And that's not like to criticize them. We've all been there where we want something to grab onto because we're afraid. And I think that along with, and I'm not saying all religious organizations, do that or manipulate them or whatever, but there is an influence with ulterior motives in some places that I've seen. And I also think there, as a result of that, there's a lot of emotional abuse that goes on. When I was 13, I grew up in a very Catholic household. And when I was 13, I was diagnosed with epilepsy. I just started having seizures.
Mm.
And I didn't grow out of it. Some people grow out of it, some people don't. And I didn't grow out of it. And, what my Catholic mom told me was, this is a test from God. And I thought to myself, a chronic illness is a test from God? What could I have, as a 13-year-old, what could I have done to have some sort of, need to be tested this way for the rest of my life? Some people will say you're sick because it's a punishment. You did something wrong. Well, I don't know. I just think that it doesn't just cause physical harm. It doesn't just cause harm in the medical system, but I also think it's emotionally abusive.
It definitely is. Yeah.
Like when I was 22, I was traveling France, and I don't know if you've heard of this before, but there's this place in France called Lourdes, and they have apparently there was this miracle where the Virgin Mary came down and by the Lourdes fountain and healed people. And so I went there not because I believe in God. I wanted to get some water from there as a present for my Catholic mother.
Mm.
I just thought it would have meaning to her. And I see people, they're from all over the world bringing humongous jugs to, and I almost said it out loud. I'm glad I didn't, but I almost said it like, it's just water, right? And can you imagine funding someone from South America with religious donations to fly all the way to France just to get water? And then these people are going to be disappointed because, well, obviously they are not cured.
The money could have been used to give them evidence-based treatment. It might not cover all of the treatment, but it could at least give them a head start in getting a specialist evaluation or something that's more tangible and more likely to succeed. And yeah, I'm with you on how frustrating this whole thing is. I've worked with a fair number of religious physicians. I've worked at I did rotations during med school at Catholic facilities, and it is very frustrating when you have this disconnect between, religion and evidence-based medicine. And I wholeheartedly agree that I don't think that churches should be able to have basically a monopoly like they do on community health. They have it on rural health. And a lot of the more service-based medical charities are run through religious institutions. And I think kind of one of the big ways that we can fight this is by establishing more secular organizations that can do the same thing without requiring people to adopt a certain belief system, that won't require people to sit through a sermon in order to get their medical care. We can have more people with initiatives setting up evidence-based groups and secular groups to go out to these communities who may have only had missionary groups show up. If you have a missionary group of doctors show up and you get treatment that you need, of course, you're more likely to lean on a religious belief after that, because that's the only group of people that gave you help. So if we start kind of getting on board and establishing services like that, I think that would help. As far as the autonomy issue, I'm 100% with Jamie and the fact that we can't force people to not make decisions based on their own, religious perspective. There's kind of some nuance with how you play out these conversations. And I think a lot of this is related to education and how we present the information. Of course, there's always going to be people, for example, Jehovah's Witnesses who won't accept a blood transfusion. There's informed consent that you have to have with obtaining a medical procedure, but there's also a degree of informed consent with declining a procedure. And there's a very detailed discussion that you should be having with patients either way. Like I can give a recommendation, and if somebody is declining the recommendation, I should be having a good conversation with them, making sure that they actually do understand the risks of not accepting this particular piece of care. Ultimately, they do get the decision. They get to make the decision of whether or not they will accept or decline. But we should still try to answer the questions, make sure that they're not declining because of misinformation. And if there is misinformation, we can address it there and then. Because sometimes it is on me. Sometimes that lapse in communication is because I phrased something inappropriately, or if I thought that the person knew something that they didn't know. A lot of that does fall on the way I'm presenting info. And I will admit there are times when it is useful to rely on a bit more religious wording for things, knowing that this particular issue isn't going to be what deconverts them. But what the important thing is in the here and now for that person may be saving their life so that later on they can evaluate their belief system. But you can kind of almost take like a little bit of a straight epistemology stance with this and just kind of ask the questions that maybe they didn't think of before. For example, if they think that an exorcism is going to like cure them, but then they also might have a belief that doctors are put there by God and have been blessed by God in order to do their job. Where's that disconnect? At that point, why are you, if you believe that these experts exist because of your faith and because of your God, why is that seen? Why are these people seen as like the secondary option, or why are they seen as less credible? Why are you not trusting them in the way that you are trusting the exorcism? There's some inconsistencies that you may hear with religious people in that. I don't know if any of that helped.
I just, in concluding, I just want to say, like, I don't care what a person believes in. When it comes to essential services like hospitals, I don't think they should be church run. I don't think there should be that religious influence, especially if it's in a rural place where whether you're Christian or not, that's the nearest hospital to go to.
Yeah. And for example, like another thing, because I've kind of been in between jobs lately, was looking at ways to do some more community medicine, and pretty much the only organization going out, well, I guess there's two organizations going out on ships, like big hospital ships. The only one that's like not military run is a Christian organization. And if you apply to work there, they require a statement of faith. So they require you to share your testimony and to be sure that you believe the right things before you go work on this hospital ship. So that kind of calls into question, is your agenda to actually heal people, or is your agenda to evangelize? And so we definitely need to step up our game on the secular humanist side and say, we can have a boat too. Yeah. Why don't we have a boat and go out and do the same things, but just not have the faith statement question? Just have, what are your credentials? And like, can you do the job that we need you to do?
Yeah, it's in an ideal world, it would be great to be able to excise like religious bias from these things that all hospitals and secular run and non-profit, if possible, and these kinds of things. But if we just, as the world stands right now, just excise religion from medicine, one, we're cutting off a massive source of resources and funding. For everything from the medical care itself to research and all that kind of stuff, and charitable care. And secondly, we are cutting off community outreach. Like if, for example, the organisation I work for refused to work with religious organisations because of their potential biases, more women out there would have missed their breast cancer screenings and their cervical cancer screenings, because it's those Sunday groups after Mass where the ladies get round and pass out the pamphlets and talk about when they should get their mammograms. And it's like, is it ideal? No, but it's the world we live in, and the change is going to have to come incrementally and really quite painfully, slowly. So I don't think it's an easily solved issue. I don't think it's one that's going to go away anytime soon. And as Dr. Ben was saying, it behooves us in the secular humanist community to try and provide better alternatives to allow people to just get what they need without any of the whole. And don't forget to thank Jesus for this healing that you have received.
Of course. Okay, well, thanks for the conversation. I just wanted to know your opinion on that.
I think we're on a wavelength with you there, Lisa.
I really do.
Yeah.
What's that, sorry?
I think we're very much in agreement with you, Lisa.
I didn't hear you.
We're very much in agreement with you, Lisa.
Okay.
Yeah, we are very frustrated too.
Okay. Well, thanks so much for listening. I really do appreciate the discussion, because sometimes I don't think that people consider like different ways religion can harm people. And I'm not saying that all religious people are like that. That's not true. It's mostly, when you see things like that, it's mostly just kind of people who are on the extreme side. Anyway, I gotta go, but thank you for answering my question, and I do hope you guys have a good weekend.
Intend to.
Thank you so much, Lisa. Have a great rest of your Sunday.